to a dentist, just a normal checkup visit, and the dentist noticed something abnormal on my tongue. When the results of this biopsy came back, it came back as what he stated was a squamous cell carcinoma.
Krista came to me from a referral from a cancer specialist in Windsor Hospital. I think the most challenging thing about Krista at the time was that she happened to also be 24 weeks pregnant.
Things were going to change for me, that I went from kind of anticipating the birth of my second to how do we deal with this situation. Most
of the patients who are faced with the diagnosis of cancer, there's questions that they ask themselves. First, why me? But very quickly, the question is, what can you do for it? And when can you treat me? It was absolutely critical that we bring her and her family into the discussion about what it means to have cancer, how we treat it, the potential impact that it may have on her, her family, and her unborn child as well.
The best part about knowing everything was that when I left that day, I knew more than I did when I walked in, and I knew what I did want to do and what I didn't want to do and what I needed to go and investigate further.
You know, head and neck cancer is an unusual form of cancer. It's the problem with head and neck cancer is that every patient who's faced with the cancer itself or the treatment will be fundamentally altered in the way they speak, the way they eat, breathe, and in many cases their appearance.
The fact that I might not be able to, read a story to my son, to read a story so that he understood it. How was I to function properly if I couldn't communicate? My memory of the surgery is more from when I woke up, trying to speak and say, is the baby okay? And I couldn't speak because you've got tubes, and I remember patting my stomach, trying to figure out what was going on. And right away, a nurse came by and she hooked up like a Doppler to my stomach, and she kind of pointed to the screen. She's like, your baby's fine. And that was like the best moment.
I don't think that you have to go any further than Krista. She was treated with her cancer 5 years ago. She was pregnant at the time, and now 5 years later, she has a completely normal life. She has absolutely normal function, and she has a 5-year-old daughter as well, so I think that pretty much sums it up.
I would tell donors that they're choosing the right place with the right people, and that they're doing everything in their power to make people better. I wouldn't really change the way anything happened. I think everything happened the way it was supposed to, and I'm so grateful that Dr. Yu was my surgeon, and it's very fortunate actually that Dr. Yu was my surgeon.